Perhaps let me start by saying that the standard of care for men with de novo metastatic disease, regardless of volume, that is high or low volume, is no longer androgen deprivation therapy alone. The standard of care has changed since the results of the charted data back in 2013 and the Stampede data from the British group around the same time. So for the past 7 years, we have recognized that combination therapy, or what I like to call treatment intensification, is the new standard of care. That is that you use the backbone of treatment, androgen deprivation therapy, with whatever GnRH agonist or antagonist you may choose. But you are now required to use either docetaxel-based chemotherapy based upon a Stampede or charted, or since those two trials, you can also use the adrenal biosynthesis inhibitor, abiraterone acetate, or more recently with the results of the ANSMET and the Titan data, you can use an androgen receptor inhibitor such as enzalutamide or apalutamide. Specifically, results of Titan are very compelling. In Titan, over 1,000 patients were randomized to receive apalutamide or placebo in that context after androgen deprivation therapy. Obviously, there's a significant improvement in survival with a hazard ratio of 0.65, which simply means almost a 35% risk reduction on mortality if you receive treatment intensification. Now, however you look at progression, where that is delaying a rising of your PSA, or radiographic progression as a composite endpoint of clinical symptoms or radiographic evidence of disease, either or is substantially improved. Again, hazard ratios in the 0.5 and 0.6 range, so drastically impacting outcome on our patients. The side effect profile, it is consistent with what the initial trial demonstrated, some obviously elements of cardiovascular dysfunction, fatigue, and some issues with with apalutamide specifically, very low likelihood in the single digits with hypothyroidism and also with the skin rash. But for the most part, quite a striking data. Again, for our community practitioners, it just simply means that when you see a patient with metastatic de novo disease, regardless of volume, you should actually always think of the addition of an ARI. In this case, obviously, with the Titan results, apalutamide would be in case.